Hey everyone, this is Type What, giving you some advice on COVID-19 from some of the things that I've learned along my way. So, COVID-19, the coronavirus, is putting diabetics at a higher risk. And I should more correctly say people with a higher A1C at a higher risk. It's something to do with the higher blood sugar levels that is making the coronavirus easily. It's easier to contract the coronavirus in the first place, and it's giving people worse outcomes, potentially death, of course. So I'm sharing what I've learned in hopes that it helps you in this crisis that that's happening right now. So I threw these slides together in just a few minutes. These are some quick tips that I've found that have helped me lower my A1C. Now, a quick background on me is I became type 1 diabetic at the age 34. And I've done a couple of things to go from an A1C of 11, which is fairly high. Anything over, 7 is abnormal. And then I was able to go down to a 5.0. Okay, so I was able to get back down into a normie's range of A1C, and I'm going to give you the tips that I did to do that because it is very important that everyone's aware of this. So the A1C has been found to be. I just mentioned this. The diabetics are. There's two groups that are more susceptible: the elderly, people that are older in age, and also people that have higher blood sugar levels. And there's one theory out there that the elderly generally have higher blood sugar levels as well. So it might all be blood sugar level related, and so that's why this is really important. Now, I've looked at a few different resources. This is one just as an example. And this isn't some random guy from Twitter. He's a Harvard professor and scientist that has a lab that's been studying this. And he says that the blood sugar levels usually are related. And this is just an example of him. And you see at the bottom, it should correlate with the HbA1c. HbA1c is the same thing as A1c. Okay. And if you're not aware of what A1c means, it's basically the average measurement of your blood sugar over a 3-month period. So as we eat carbs, right, and do things, we eat carbs, our blood sugars go up, depending on how well your state of diabetes or the level of your insulin resistance. You can go up really high. As we do things like exercise, the blood sugars go down, or we take insulin and the blood sugars go down. Okay, so the A1C takes kind of a 3-month average of all those peaks and valleys and puts it into a nice number. But in general, it's the high blood sugars that we want to be aware of here. So Dr. Bernstein, if you're not aware of him, you should go get his book, Diabetes Management. He has this concept that he calls blood sugar normalization. Is instead of having your blood sugar spike by eating high carb stuff, and then correcting with insulin and maybe overcorrecting, and then you go down, and this is called the diabetes roller coaster, right? So his concept is know very, very precisely the amount of carbs you're taking, and very, very precisely the amount of insulin that you need based on your body and your state of your diabetes to counteract that amount of carbs. And do small doses of carbs and then, of course, that correlates to small doses of insulin. So the smaller numbers you do, the smaller spikes you do, the more you're going to have a flat line of your blood sugar levels. Instead of eating a piece of cake, right, and taking a bunch of units and then going down, and then taking, the candies, to shoot back up to get to normal level if you go hypo. His concept is stay as flat as you can by being very, very precise and being knowledgeable about your body. Okay, so this is something that I have done, and it absolutely works. Okay, now another factor that Dr. Bernstein does not get into, which is probably the biggest thing for me, is the insulin resistance. So the more insulin resistance you have, usually the higher A1C you have, right? So type 2 diabetics, the reason they're diabetic is because of their insulin resistance. They eat things that they eat high fats, and that clogs your glucose receptors, and so the insulin that triggers your glucose receptors to open so the glucose can come through and come out of your bloodstream. Those glucose receptors are clogged by the fats in your diet. Okay, so but to improve your insulin resistance, you reduce the amount of fats that you eat in your diet, and that will clear up your insulin receptors, right? And then the insulin that you produce or that you take from your insulin pen will have more effect. Okay, so that means less insulin will be needed to pull the glucose out of your blood. Okay, now this might be a process for someone with type 2 diabetes where their insulin resistance is really high. For me, just so you know, this was crazy for me. So I was diagnosed as diabetic in general, sent to a specialist. She said, well, it looks like you're type 1 because you're thin and you're young. So I was like, okay, but can I get some tests done? And sure enough, the tests, and I have all the antibodies and stuff for type 1, and she put me on insulin. However, the same week I was diagnosed, I also started a whole food plant-based diet to support my wife, and totally separate, total coincidence she was starting this diet. I just did it to support her. 6 weeks after going on that diet, 6 weeks, guys, I was able to get off all 6 of my medications. Okay, so I was on a few pharmaceutical drugs and then the 2 insulins that you're put on, the fast-acting and long-acting. Okay? So I was able to get off of my insulin as a type 1 diabetic. Now, what that really means is that I'm not quite a type 1 diabetic. There's this thing in between called a type 1.5, or your honeymooning, where your body, you have the type 1 markers, right? You have the autoimmune response, but you do produce a small amount of insulin still. Okay? The only way I was able to discover this was by changing my diet, reducing my insulin resistance to the point that we could discover this. And so I was able to go off of even my insulin and eat a low-carb, plant-based diet that low-carb, plant-based diet that kept my insulin resistance low and not need insulin after my meals. Okay? So this is crazy to most people. Some people say I'm cured of diabetes. I feel like I'm halfway cured, right? I'm trying to personally work through the rest of that, which is not the concept for this video. But this is what my personal testimony about insulin resistance and how real diet can be to transforming your insulin resistance. Okay, so the low carb plant-based foods. I'm going to go over a couple of different plant-based foods. Unfortunately, the animal fats, animal proteins, your meats, basically, your dairy, your eggs, milk, cheese, your red meat, your white meat, even your fish. Okay, they drastically increase your insulin resistance. They are bad for your insulin resistance. As much as I like the taste of those things, every time I do an experiment where I add that, or I have a cheat day, I can feel the effects for almost a week, sometimes more depending on what I ate. Okay, in terms of my insulin resistance, meaning I can tell the numbers, my glucose numbers just go up and stay up a lot higher whenever I have meats or animal products. Okay. So if you want to really take a huge step here, now this is again, this is really serious, right? So it's more serious than having diabetes by itself, right? You can manage diabetes and still live a long life. Dr. Bernstein's a good example of this. He hasn't focused on insulin resistance at all. He focused on blood sugar normalization, and he's lived to be 80 years old. Okay, so you can manage it that way. However, there's something new in our environment, the coronavirus, and having the higher blood sugars can kill you, and that's very scary. So I hope the motivation is there for you to take the actions that are available to you. So, and one of these for insulin resistance is the low carb plant-based foods. So this is mostly, these are some examples of the types of foods that I eat. I post a lot of recipes on my social media channels. If you have questions about what to make with all these ingredients, just let me know. I'll be happy to share. Okay, so number one thing is leafy greens. So your kales, lettuce, cabbages, Brussels sprouts. Okay, so you can have those in salads or in soups or any kind of dish as a side or even as a main thing. Cauliflower and broccoli are super good for you. I like to eat those raw. I put them in salads, but you can put them in, you can steam them, you can put them in soups and stuff like that. Mushrooms as well as the other two, very low carb. All these things are low carb and very good for you. Okay, now avocado is a special thing. It is high in fat. Okay, it is high in plant-based fat. And I have found that I do very well with avocados. You get a lot of nutrients from that. You get avocados have the fats that you can burn for energy. So my body will go into ketosis. So I'm kind of a keto vegan. It's kind of how my metabolism has been working. Since I'm so low carb, I do use fats to get energy from them. And it's crazy how the plant-based fats really are different from the animal-based fats. So that's why you see avocado and coconut, two very fatty fruits. Okay, but my body responds extremely well to them. So I actually have a lot of those in my diet. Celery is another good one. You can pair it with lots of things. Onions is used in lots of recipes, and of course tofu is one of my staples. I use that for my main protein source. Okay. So these are all low-carb plant-based foods. You can have as much of these as you want quantity-wise, and your blood sugars will not spike. Okay? Now, if you're going to do the leafy greens, you're probably going to do a salad dressing. You have to be careful with your salad dressings. Okay? A lot of salad dressings have a sweetener in it, usually sugar, so you have to be careful of the carbs in your dressings. Okay, my wife also has very good almond butter vinaigrette that is low. It's very low carb. Almonds themselves do have some carbs in them, but if you eat it in moderation, right, you don't drown your salad, you'll be totally fine, and it's very tasty. Okay, so the first question people ask after I tell them I eat vegetables for life, right, is they say, well, where do you get your protein? Okay, so this is the short answer. Most of my protein I get from tofu. Now, I eat tofu because it has a high amount of protein, a low amount of carbs, and a low amount of fat. Okay, so I track my macronutrients. I make sure that I'm getting the right amounts for the exercise, the activity that I'm doing during the day, and also my recovery time for my muscles. All right, so tofu is my top go-to for that. It's also very affordable, and it lasts a good amount of time in your fridge. Okay, so I like tofu for all those reasons. You do need to season it. Okay, tofu is not very tasty by itself. Similar to how unseasoned chicken, right? If it's not soaked in salt water, like how you get it at the grocery store, or on some other unseasoned meats. That doesn't taste very good. So you have to, the key with tofu that most people get wrong is they don't season it right. Okay, so I have my favorite recipe right now for tofu I'm making is a garlic tofu scramble. Happy to share that with you. Makes it taste very good. I look forward to these meals. I'm actually going to have some more after this video. So another common source of protein is nuts. So most nuts will have they kind of have a high fat content. They will have a medium carb per serving and a medium to high protein per serving. Okay, so the nuts vary slightly, but in general you can group those. It's a good protein source, but I generally don't like doing too much nuts because they have a medium carb count. And so if I pair that with other foods that have a low carb count, my carb count can get higher than I want very quickly. Okay, now seeds. Seeds are similar to nuts. They have usually a high fat, medium carb, and medium to high protein content per serving.
They are also a very good source of protein. Legumes, beans, they have similar. They have higher carb. Okay, so beans are, I consider, a high carb item. They do digest slowly, so you'll have a trickle of carbs come in over 3 hours or so. But they do have they are a good source of protein, but they are higher carb. Okay. And also, most people do not understand that your regular vegetables, all the stuff I mentioned on the previous screen, it has protein in it as well. Kale has protein, right? Your salad has protein. And there's what's the word I'm looking for? Conflicting views on how much protein you really need. I found for my energy level that I do need a good amount of protein, especially since I'm active and I do exercises. But there's another tribe that says, the amount of protein that we're prescribed by, the standard U.S. recommendation is probably twice as much than we really need naturally. So some people say, I don't need to supplement my protein with any of these extra foods that you see on the screen. I can just use my vegetables and stuff like that. I found I need a little bit more just from an energy perspective and for my muscles. Otherwise, I just lose muscle really fast. Okay, so that's where you get your protein, guys. You get it from just about everything you eat in small amounts. So if you eat large amounts of the small protein items, you will get enough protein. But if you feel like you need a spike of more things, if you're athletic, I would add your tofu, nuts, seeds, and beans to your diet. I would be careful with your beans if you're trying to stay low carb, okay? But you can add them for variety and in small amounts. Okay, now there are healthy, high-carb, plant-based foods. These are things that are very, very low in fat, and so this will aggressively reduce your insulin resistance if you have a high insulin resistance. So if you're pre-diabetic, type 2 diabetic, or type 1.5 diabetic, when you need lots of insulin to get your numbers down after a meal, you can do high carb plant-based foods. If you're using insulin, you have to measure and figure out the amount of carbs you need per the insulin you need. And if you're doing this for the first time, it might change kind of quickly over the next few weeks. Okay, so keep a close eye on the carbs you take, the insulin you need, and you use to counteract it. And the result of that, I would try to keep it every day, since this is a very serious situation. And make adjustments as you go. Over the next 2 months, you're going to have probably significant changes in the amount of insulin you need to reduce your blood sugars based on what you eat here. So these are very nutritious, high carb plant-based foods. So fruits, of course, are very good. Grains, I stay away from grains the most because they will hit my system for about 4 hours, and that's longer than my fast-acting insulin. I sometimes, if I take too much, like on a cheat day, I will have to do two doses of insulin spread out to counteract that. Oats are extremely good for you. They're extremely cheap if you're doing your emergency stockpiling. Oats are very good. Beans here, I mentioned again, beans, rice, corn, and potatoes. All these things are very good for you. Favor the organic types. But these are high carbs. So if you're going for the blood sugar normalization, have these in very small quantities. Some people feel like these are things that fill them up. You can eat more quantity of the low carb things, or you can mix in some of these things that are a little bit more filling, but counteract them accordingly. And so you can counteract them with insulin or exercise, which I'm going to mention next, maybe. Next. Perfect. So if you don't take insulin and you want to lower your post-meal blood sugars, you can use exercise. This is a trick that I've been using since the beginning. I didn't know why it worked up until recently. There's something called the GLUT4, which is a pathway other than the glucose receptor, right? The glucose receptor is triggered and opened by your insulin, right? So with zero insulin, the GLUT4 pathway will open up and take glucose out of your blood. Okay, let me say that again. Without insulin, type 1 diabetics, I'm talking to you. You can reduce your blood sugars with exercise using the GLUT4 pathway. So what happens is when you exercise, your body's like, hey, I need energy for my muscles, so I need to get it quickly. And so then, it basically it opens up the GLUT4 and that pulls the glucose out of your blood. Now, when I do this and I have not dosed insulin, which is most days, it doesn't matter how low I go because my body will naturally stabilize in the 70s, usually glucose levels, right? If you are taking insulin and you do exercise, be careful because you can go hypoglycemic. If you've been type 1 for any period of time, you're probably aware of this. Some of your doctors might have said, don't do exercise, which is, I think it's bad advice because exercise in general is healthy. Manage your exercise and your insulin. That would be I'm not a medical professional, okay? Consult your doctor, I got to say that. But managing your exercise and managing your insulin to your exercise accordingly. Okay, so these are the two types of exercise that I use to reduce my blood sugars after a meal. So if I eat something that's higher carb, if I eat grains, if I eat those beans, okay, I'm probably going to have to do cardio depending on how much I ate. Count your carbs, count your macronutrients here, and depending on your body, you might need to do some cardio. Okay, you can do walking. You can do like a fat burning zone, just a regular walk for 20 to 40 minutes. The best time to do that is within 20 minutes after your meal. So if within 20 minutes after your meal, right, you finish eating, you wait 20 minutes, then you go for a walk. That walk should be 20 to 40 minutes, and you're going to see a good chunk of your glucose never rise beyond what you're used to. That's a very good trick that I use almost daily for after dinner time. However, if your blood sugar gets really high, what you can do is a cardio workout. So I do a light jog. I try to keep my heart rate between 120 and 140. Okay. Now that's for me. I'm in my late 30s. Here is the exercise zones. So what we want is the blue section there that says cardio endurance. It depends on your age. If you look at the top under exercise zones, it has the age. So you want to find your age, then go down to the blue section that says cardio endurance, and find the heart rate around which you should be in to get the same results. Okay? So typically, when I do a 20-minute cardio session, I will drop about 100 points in my blood sugar. Okay? And typically, I don't take insulin, so I'm able to drop that 100 points maybe in the first half of my exercise, and then I flatten out at that level in the 80s or 70s through the remainder of my exercise. So you do have to be careful of your insulin usage if you're taking insulin, and manage that accordingly. But this is an excellent tip. Okay, so any time of the day, no matter what happens, no matter how much insulin you have, you always have this trick in your back pocket. Okay, so there's two things that I do that you can use anywhere. One of them is air squats. Okay, so you can do air squats. Get your friends to do it with you, family members to do it with you, or just be brave and just do it. I've done it at restaurants, either in the restaurant or outside the restaurant right afterwards, or you can just go on a walk. That's more in the social norms of things. It depends on the weather, of course, but little things to get your heart rate up, gets your circulation going. It promotes the GLUT4 to pull that glucose out of your blood, lowering your blood sugars, lowering your A1C. Okay, that's what all this is geared towards. Okay, so know your carbs and know your doses. Count your carbs before you eat. This is the best way I found to do it. Sometimes I'm hungry and I skip this step, and it leads to poor management. Right? If you don't do this, you're going to have poorer management of your blood sugars. If you do this, you will have better management of your blood sugars. So it's a very simple thing. Count your carbs, know your carbs before you eat. Your insulin dosage will be better. Your exercise amounts and timing will be better. And your blood sugar normalization will be better. Your blood sugars will be lower. Your A1C will be lower. You won't have to correct any insulin dosage and then go back up on the roller coaster. So I do highly recommend that. It's a very simple tip, and it's taken me a while to figure that one out. It's just a little tiny thing I can do that has a big improvement. It's a good habit to have. And then, of course, know your carbs versus your insulin units. Okay, if you're type 1, and also be aware that this might change if you're working on your insulin, reducing your insulin resistance. Okay, so keep track of these things. It's very, very valuable. And one thing Dr. Bernstein also mentions is in his book is the law of small numbers. Okay, now this is very important. So if you have low insulin resistance, right, and you take, basically, let me explain the law of small numbers. The law of small numbers means as it relates to diabetes, is if you take a small amount of carbs, that means your blood sugar will rise by a small amount, okay, and then you need a small amount of insulin, and so to lower it. Okay, so even if you so this helps with your margin of error. Okay, so if you're erroring on your carbs and you take a small amount, the error is also going to be small. If you err on your insulin for that small amount of carbs, your error, right, too much insulin, is going to be small. Okay, and that helps you keep that flat line, right? If you're going to eat 1,000 potatoes, okay, your carbs are going to be crazy, and the amount of insulin you need is going to be a lot, and that can very easily lead to the overcorrection, which then you need to have the spiky sugars to get you back up, and it can lead to the roller coaster that you're probably familiar with. So what he's saying here is small numbers. A lot of small numbers enables you to better keep your blood sugars normalized. So lower insulin resistance, meaning the insulin you have or take will be more effective. Eating lower carbs so that you have less lower corrections and less margin for error. It'll lead to lower blood sugar spikes, smaller corrections, and flat blood sugar levels over time, and lower your A1C. Okay, so we want to lower your blood sugars, keep them low in the normal range, and that's the takeaway that we have here. Okay, so if you have questions, please leave them in the comments below. I'm not a medical doctor. I've run lots of experiments on myself. These things have worked on me. I didn't come up with a lot of these things. I've read them in books by actual doctors. So they work on more than just me. And we're in a very serious situation with the coronavirus. So I want to share these things that you can use to keep your blood sugars low and reduce your hopefully reduce your not your exposure. That's the word that keeps coming to my mind, but that's a little bit different. You want to reduce your chances of getting the coronavirus and reduce your chances of having a bad outcome if you do contract the virus. Okay, guys, I hope this helps. Please leave me a comment if you have any questions. Okay, bye.